afternoon, everyone. I'm delighted to see everyone here today. And, we always talked about if one place you can sacrifice the time of the week to be is be here. It always gives me a special spark and comfort when I know I can come to join in with these members who professionals who sacrifice at least half an hour of their time just to be in, just to make the country a better place. And so we really appreciate you. And like I always say, there's no better place to be is in the Rotary Club of Nassau meeting. You had no other choice. Those of you who are here, you had no other choice. This is the place you had to be here, even before you were born. So you had to be here. Thank you, thank you, thank you. Okay, Latice, it's all in your hands.
Thank you so much for trusting me and guiding this meeting today. I'm sure we're gonna all be well informed. We're gonna learn. Take so much from today's meeting. So please join me in giving grace. O God of all people, we thank thee for Rotary that brings men and women of all vocations and nationalities and races together in fellowship and service. As we share in this program, may our lives be enriched with greater service over self. Amen.
Amen.
And now we're going to call on PP Jamal with the welcome of all visiting Rotarians, guests, and non-Rotarians.
Sorry, just before we do that, we need to do the loyal toast.
I thought you forgot me.
I'm so excited.
President Stephen, fellow Rotarians and guests, can you raise your glass for the loyal toast? The Queen and the Commonwealth of the Bahamas.
Queen in the Commonwealth of the Bahamas.
Toast to the Queen, followed by Jamal. Jamal, we are welcoming you again.
Thank you, Rotarian Latice. President Stephen, and to the board of this great club of ours. I can't say little club no more because, we are really making some headways. But I must well say that it's really good to see these new vibrant faces. Latice, opening up Latice. I see in my old schoolmate, not old, but my former schoolmate, Valencia Johson in the place. I tell you, Mr. President, we are making some headways. One time ago, I used to say that Rotary Club of Nassau is a little club that could, but now we're a big club that always will. And I might as well say I'm really happy to be amongst all of you. Chantel doing your thing, and all of you Rotarians. How good it is
but President Jamal, past President Jamal, when we have a person like you sitting in a flash office, looking like you have an executive secretary, looking like you have your coffee table and I'm the chef and all that, we gotta be good.
All right. Well, as we say in law, we gotta at least look the part.
I got you.
All right, but it's indeed my pleasure today to welcome each of you here to this meeting today. I'm sure that our administration team, led by Chantel, has a good program on the agenda for us. I see that I have the task of responsibility of also introducing our visiting Rotarians. So at this stage, then I'd like you all, any visiting Rotarians, to please identify yourselves for us. The camera automatically goes on persons as they identify, right?
Yeah.
Do we have any?
It doesn't look so.
No? You mean everyone here is on our club? Wow. All right. Awesome. Boy, I tell you, we are indeed making headway. Well, good to have each of you. What about Rodney? I see Rodney Bain. Is Rodney Bain a member?
He's not a Rotarian yet.
Oh, okay.
Not yet.
All right.
Not yet.
Not yet.
Work in progress.
Boy, we're making some headways here, Mr. President. This is record.
Work in progress.
So no visiting Rotarians. Then I'll go on then to our non-Rotarian guests. Any Rotarians have visited a non-Rotarian guest with us today?
I'm going to take the guest from our guest speaker. Miss Ingrid Johnson is on today. She is Dr. Valencia Johnson's mom.
Oh,
So I will take her on as my guest today.
All right. All right, well, welcome, Miss Johnson.
Thank you very much.
Good to have you in the place today.
great. Delighted to have you.
Valencia, I heard Chantal say Dr. Johnson, but as mom is on, can I mention some old stories of QC or save that for another time? I'll save that for another time then. All right. We do have some apologies today. But also, Chantal, you mentioned that Rodney Bain is also visiting with us today. You got to take responsibility for Rodney as well?
Ow.
I would like to, but unfortunately his Rotarian is here.
All right. Oh, that's Nadia's husband. Okay. All right. Sorry about that, Nadia. Go ahead, Nadia.
I see we have a couple of other names here, Lisa Bastia and Rosemary Smith.
Okay. Well, a big welcome to all of you today who are visiting us. Rosemary, good to have you.
Thank you. I'm visiting. I'm the guest of Keno McCartney.
Awesome.
Oh my goodness.
Awesome.
Okay.
What happened to you? I saw McCartney's name. How come you're not speaking up, Mr. McCartney?
Listen, I was just waiting for the right time. Because, listen, Rosemary and Sandra, by next meeting, hopefully they will be new members. We are growing and growing.
That's right. That's right.
Okay,
Yes, yes.
awesome.
Yes.
I love your prophetic words, you know.
I know how to speak it in the atmosphere.
All right. Awesome. Okay. Well, lovely. Good to have each of you with us today. We do have some apologies from Rotarians. We have apologies from Falia, Laverne, Samita, Darren, Raquel, and we should expect to see Sheila momentarily. All right, so I'll hand it back over to our moderator today, Latisse.
Mr. Davis, just before you do that, I have a special guest that just joined.
Please, Mr. Davis, Jamal, please, all right?
Jamal,
I may look old, but I'm only 21.
I have a special guest that just joined, Mr. Jeffrey Jerome Randall. He's here, and my darling wife is joining me in the car today, so she's my guest too.
Awesome, awesome. Welcome to each of you. Welcome. Awesome, thank you. All right, so Rotarian Latisse, I'll hand it back over to you.
Thank you so much, Jamal. Now we're going to go into our raffle segment. However, I have a little joke. It's not that funny, but it's going to ease us. It's going to transition us. So a man walks into a bar with a pig under his arm. So the bartender said, "Where did you get this disgusting creature?" So the pig answered, "I won him at a raffle." And here begins our raffle segment, Jamal.
Wow.
I said it wasn't good.
Way to go.
All right. So for those of you who may not know, we partook in the health seminar, vision training, health expo, where we did eye care for the students in the Bain and Groundstown area at Stephen Dillard. And this year we added a raffle for a cellular phone. I think it's one of the latest editions of a cellular phone that was sponsored to us by BTC. So all of the participants, the students, as they did their eye testing and care, they all got a number. And we have the numbers here in this box or this buy package. And I'm going to ask my assistant, Ms. Pinder, just in an effort of transparency, to pick out a number for us so that in case you all don't win, you don't come back shooting at me. All right, so Ms. Pinder, if you could pick a number there for us, please. We shake it up and then, yeah.
2 is right, Ms. Penda.
Okay, so drum roll. All right. And the number is number 116.
116, okay.
Okay, so I think Chantal, we can organize with Anita to get the phone. Look at my.
Yes.
You see a phone there? Wait, that's me quickly, please. All right, let's get this phone to get this number to Anita, and we'll organize getting the phone. Letitia, when they get the phone, I just want to show you all it real quick. Okay, so this is a Samsung A11. I imagine this is one of the top of the line ones that will be given off to ticket number 116. All right. Thank you. Letice, back to you. Do not call me back on for another while, okay?
You did a fantastic job, Ms. Jamal. Please help me welcome our president, Mr. Stephen Dean, to bring remarks and announcements.
Oh, I was looking for some more fun time. I was enjoying myself in the background, just having a good time, you know. So I hope that, you know, I know your imaginations have been stimulated based on the speaker we have today, but I hope at the end of the speaking engagement of the presentation, your curiosity will be fulfilled. Always the delight of mine to have all of you and in our meetings, our hardworking board members and all our members who are working extremely hard. I noticed a number of y'all have done some volunteer time at the COVID vaccination site, and I must applaud you for that. You're doing a great job, and I think some people are actually there today, you know, and so we really want to thank you for that. And there's still room open that you can register to work at any one of the sites, and that goes for our visitors too, friends, family, anyone can volunteer to work. I think it's a good thing to help our country in moving forward. It's a good process. So thank you very much for that. I think we are doing good. We have had some great projects, particularly last month, and I want to thank all of you for your support, all of you for the coordination, all of you in your respective role who are doing extremely well. We realize that we cannot do good without you. So the club is not just the president. Normally you'll hear in organizations, the name of the head will always be called. If there's success, you'll hear. If it, like, you know, I used to be in the police force, although the officers on the ground doing the work, when you hear the commissioner's doing a great job, all right, that normally happens, but that does not really always be the true reflection. So that's why I want to say today, I want to thank all of you for the great work that each you are doing individually. And, you know, life is like this, you know. When you're not expecting a reward, you just wake up in the morning and meet it right on your bureau or meet it somewhere. You just meet it there. It just happens. And the reward comes when you're not expecting it. I love them kind of rewards. I like to be surprised with rewards. If I know that on the 27th of this month, I'm going to get a reward, no surprise. I may put on a fake smile when I get it, you know, but that's how it is. So I want to thank all of you. All of you, your president has got you. Your president have got all of you all in mind. All of our new members and all the new board members who are getting warm up for next year. And our new president, Brother Mike, you see how Mike looks so relaxed with that picture shot he got? It looks good. The president is ready. Don't mind him leaning back like that. He's just relaxing on some beach today, but still with the meeting, you know, having a good time. So we want to thank you for all that you do and all that you do to support this club. And I think it's a great club. And things are going good. Our new members, they are really pushing. I really want to commend you. And our senior members who are giving inspiration. You know, I can't have a meeting without Dr. Larry on it, you know? So when I see Dr. Larry and Jim and Joan and all of Sonia, I mean, Sheila and our whole crew, we feel good. And then all our past presidents who constantly support us, we feel good about what is happening today. So I want to thank you and I thank our visitors who have joined in this meeting today. If you feel touched, if someone touch you the left or right side or on the shoulder, feel free to come back to the meeting next Tuesday, you know, because that touch might mean something. You know, when you particularly you ladies, when you say you have mother's wit might be telling you, come and join this club. Come and join this club. Thank you. Before we bounce out, Joan, do you have any Treasurer Joan, Secretary Joan, you're on? Anything of important?
Reminder or a notice of the board meeting next Monday at 6 o'clock on Zoom.
Yes.
And also, Sheila's not on today, but you know, she has received a lot of Rotary magazines, which she really does not want, because many of you new people have not gone on to, and you need to go on to My Rotary rotary.org and change your address from her address so that it will come to you, or change it to get it virtually. So that's important because the Rotary magazine is, of interest every month. Even if you don't read it all, you can read it, go through various aspects of it and you will see what's happening with Rotary around the world. So please, please go on and change your box number from Sheila's to yours. Thank you.
Okay. Thank you, Joan. Any of our board members and from your areas, do you have any announcements? Anything you want to share? Anything you want to say? But Jamal, you had a very good the eye examination. I knew with the Dr. Anita and the whole team, and I think you can give a wrap up and just say how it went, how successful it went, and what the future plans are.
Yes, I will say, President Stephen, that this year putting on the vision screening project has, I would say, overwhelmingly that it was the best one ever. I think that it was organized far better than years gone by before. Additionally, we got tremendous support from the club and the Rotarians. And I must give kudos to a lot of our newer Rotarians as well, who also participated in very meaningful ways. And I certainly will not forget some of our older Rotarians who's always been there and was there again this time around. But I might as well say that through Dr. Anita's innovation, we were able to enhance the project by having the glasses, pretty much the persons who needed glasses to be able to pick out the lens that they would like, and I didn't, not being a glasses person myself, but didn't realize the significance of that. But the fact is that you're going to be wearing these glasses, so you want to have something that you're comfortable with as well. So they had the ability to do that at the project, and I think, well, not that I think, but I know that it was extremely successful, and I want to really applaud each of you Rotarians for the fact that we were able to bring that project and successfully complete it. So thank you all, thank you, and I think you all ought to put that under your belt to say that your club was able to bring some sort of relief to the children who are in need inside the Bain and Grandstown community.
Thank you, Past President Jamal, and I wanted to commend you and your team. I mean, just a great work that was done. So much so that other organizations are calling upon us. Can we help? I tell them we can't bite too much off. I want to go with the. I think our little children, the youth of our nation, if we can help them, I think it's significant. So I think it went extremely well, and I want to commend you. And I think we had good support from our club Rotarians, and we cannot say enough thanks to Dr. Anita, and who brought in the teams and who coordinated along that. So that is good. It's a good pick that we have in our club. So I think it's worth and value. So we really appreciate what happened there. So we want to thank you. And Jamal, we haven't forgotten you. You know what I'm talking about, right? We can solve that.
Okay.
President
Yes.
Stephen, just to add one more comment to that, the nurses who from the public health, they were very involved as well with getting persons out. They were extremely grateful for the fact that we took the time out to take on the extra 20 persons last weekend. I got, they kept sending emails and messages saying, thank you, because, they thought that, okay, they would have to try to find another avenue to get those persons assistance. But they were extremely grateful that we took the time to make sure those persons were seen.
Okay.
Well.
We really want to thank you for those kind words for the nurses, and we are much appreciative. Jamal, I think you want to hit on the point, because I think an acute situation came out of that. But I think would have identified but a young child. I think the club should hear this,
Yeah. All right. Thank you for President Stephen. That's right. What the doctors were able to diagnose as well, or I should say in other ways, the doctors were able to diagnose a toddler, a 2-year-old child whose sight is significantly impaired. In fact, if he doesn't get necessary treatment within a short period of time, he's likely to be blind. So our team, comprised of the doctors involved, as well as the nurses, are now engaged in finding a way that we can get that child necessary treatment. And we now await a report from Anita and the nurses as to exactly what form of treatment we can get for that child. So this is what we are dealing with at the moment. And I think, again, it's a reflection of the significance of projects of this kind. So we are all now engaged with trying to get this child relief. And as you reminded me, President Stephen, I got to get back to Anita and the nurses so that we could bring a closure to this matter and get this child relief. How wonderful it would be for our club to be able to intervene in this person's life in this way. So Rotarians, please keep the fire going. You know, you heard about it here today. Keep the fire on us to make sure we bring relief to this young child.
Okay, thank you, Past President Jamal, and really, this is what we are all about. This is what Rotary is all about. Jamal, some things are happening behind the scenes. Some things are happening.
All right.
Well, I could rest you assured that, you know, because it seems like you were praying. Seems like you was a praying man, you know.
Oh, yeah. I got to, and I have the drill sergeant Stephen as president.
Okay, we good. Okay, thank you very much. Some good stuff. That's just one of many of the great things that is happening at this club. We can be all day just talking about the great things. Back to you, Latice. I know I took some of your time. Back to you.
Thank you, President Stephen, and past President Jamal Davis, and you and your team. Thank you for the good work you've done in that community, and that we will continue to do. At this time, I'm going to welcome back our one and only past President Jamal Davis for the entertainment and fines.
All right. All right. Well, first of all, I'd like to start off our fines with our moderator. Apparently, whilst we were having our discussions, she was having a juicy conversation on her cell phone. And if you look in the chat, you'll see the picture by way of evidence of it. Is all there reflected inside our chat.
Okay.
All right. Let me look at some of these pictures. Rotarian Chantel, I don't see any.
Yes. There's my pen.
All right,
there's my pen.
Go.
Thank you.
All
Thank
right.
you.
Jamal doesn't wear no pin. Jamal, you ain't wear no pin.
Hey, I wasn't supposed to be sergeant today. All right. Now I think a few Rotarians came after the bell. You know, when we met at Luciano's and wherever we end up meeting, you know, we always had a challenge with Rotarian Mark coming before. Well, actually, no, it wasn't Mark. Mark was usually on time. But Mark, I don't understand though. You were on time when we came in person, but now you're coming late on Zoom. So, Mark, I think we're going to put a fine for Rotarian Mark Munnings for being late on Zoom. There's no excuse for that. All right. I want to fine Rotarian Sandra as well. Normally, I get to hear from Sandra quite often. I haven't heard from Sandra for a while. So I want to fine Sandra for not being able to hear from her for a while. All right.
I think I'll just sing. I don't even know what to say anymore.
All right. Tamika, you came on after 1 o'clock, so you're fine as well. All right. And those of you who I might have missed, please remember our four-way test. Is it true? Is it fair to all concerned? And remember those two lines of our four-way test. So if you know you came after the bell, please ensure you send to Secretary Joan. You're fine. Joan, I certainly will. I'll get it to you somehow, some way, someday. All right. Let's see. Rotarian Nadia, you fine for leaving it cold for a while for someone to introduce Rodney. So you're fine for taking a while to do that, Nadia?
Powerful.
All right, let's see. Alton, you're pretty quiet in the back there. Chrislyn, you're fine for not having your video up. We can't see you today. Are you actually there?
Hey.
Yes.
She's there? Okay, okay. All
She's
right.
there.
So I think Chantel, do we have any birthdays, anniversaries?
No, not this week.
Not this
Last week was really busy, so this week is quiet.
So
We wait
no
on
no
closing
babies
next
in
week.
April. April, the middle of April. What that means then.
Did you hear the one who says she's
We
coming
wait
up
on the
next week? Did you hear
explosion
that?
next week.
Oh yeah, who's that? Who said that?
Lucky
That's
like
Tamika.
420. Lucky 420.
Oh, 420.
420?
Yes.
Okay.
Yes.
Tamika, you gonna be 42?
You stay right there.
But Jamal, put the order in for the cake and drinks in advance. I think we've been giving them notice too late. That's why they're not getting the cake to us, you know?
Oh, okay. Well, Tamika, we do expect to have a cake. All right.
Hold on, Jamal. Is this a 420
right.
cake? Is this a 420 cake you asking for?
Hold on. Okay. I'm a bit behind the 8 ball. What is this 420 y'all talking about?
Oh
April
gosh.
20th.
Go Google it, man, Jamal. Go Google it.
Yeah, Google it, man. I don't know if I want that recorded. So just Google it.
420. Let's see.
My God.
Anyway, I will check that out. All right.
Yes.
But, yes, Rotarians, keep up the good work and pay your fines if you have any infractions. Thank you. I think that's it. You'll hear from me for the rest of the evening.
Thank you so much. I think that is it.
Oh, actually, Latiz, I just remember I have one joke. I have one joke. If I have time. Do I have time?
Yeah, Chris, a joke.
Okay. Here we go. Now, don't blame me if you don't like this joke. Letisa, my assistant who you just saw, she gave me this joke. So don't blame me. But here we go. 3 women, a redhead, a blondie, and an agent have just escaped from prison, and the cops are looking for them. The girls were running through the city and went into one of those fruit vegetables market to hide and found 3 bags of potatoes big enough for them to hide in. After a while, one cop that is looking for them finds the bags and realizes that they're kind of weird looking. So he approaches and kicks the first potato bag with the young Asian girl inside it. And the Asian girl quickly responds to the kick with barking noises. Woof, woof. Oh, these are just a few dogs, says the cop. Then he approaches the second potato bag with the red head inside it and kicks it as well. Meow, meow, the redhead answers. Oh, these are just a few cats, says the cop. Finally, he gets close to the third potato bag with the blonde inside it and kicks it too. The voice inside the bag responds, potatoes.
Potatoes.
All right. Well, I'll take credit for that one since I got you laughing then. Thank you. My pleasure.
You're welcome. Well, Jamal, they do say blondes have more fun. At this time, we're gonna introduce Rotarian Nadia Bain to give the introduction of the speaker.
Thank you so much.
You're
Good
welcome.
afternoon, everyone. Dr. Valencia A. Johson was born and raised in Nassau, Bahamas. She attended Queens College, where she realized she wanted to become a pediatrician. She obtained a bachelor's degree from the University of West Alabama, then went on to obtain her MBBS from the University of the West Indies, Mount Hope campus in Trinidad. She furthered her medical education by obtaining a DM in pediatrics from UWI's Nassau and Jamaica campuses. Dr. Johson has a special interest in pediatric nutrition and is a part of the Healthy Lifestyle team of the Bahamas. She is currently employed as a senior medical officer in the Department of Public Health and the Pediatric Place. She is an associate lecturer of the University of the West Indies and is a member of the American Academy of Pediatrics. When not practicing medicine, she enjoys reading, learning about investing, traveling, and a good glass of wine. Fun fact, she recently began hosting Sip and Bake events. As Rotary celebrates Maternal and Child Health Month, please join me in welcoming Dr. Valencia Johson to discuss how well visits contribute to a child's well-being.
Hi. Good afternoon. Just want to say thank you to Ms. Bain for inviting me to give this talk. I appreciate being a part of your Maternal and Child Health Month. I think it's very important. And well visits are actually one of the most exciting things that I think is about pediatrics. So in terms of well visit, it actually falls under primary care pediatrics. And it doesn't have to be given by a pediatrician. It can actually be given by a family medicine physician or a pediatrician. It depends on where you are. So countries like Canada, where they have like national health, you don't necessarily see a pediatrician unless you have a problem or they think that there's a reason to refer you. But like here in the Bahamas, you have options depending on what type of, if it's government versus private healthcare that you're getting. We have options of actually seeing specialists without having to be referred. So primary care, which is what we would consider well visits to be, is supposed to be comprehensive care that starts in the neonatal period, which is the early infancy. We actually start seeing the babies from there in their mommy's tummy. So we would get the prenatal visit and we see them up to 18 or 21, depending on where you're practicing medicine. Ideally, it should be given by the same person straight up, but that doesn't happen in the government system. You would see whoever is available, and most often you would see probably a family medicine physician or a general practitioner. But ideally, primary care or well visits should be carried out by the same physician straight up until we graduate you to family medicine or internal medicine as an adult. So one of my pet peeves in Nassau is that most kids don't necessarily come to all of their well visits. And I don't think people understand that they are important. Sometimes parents would consider the vaccine visits the only set of well visits, and they don't bring children to be seen outside of when they are due for immunization. So that's not how it's supposed to work in pediatrics. Ideally, we should be seeing them every year, whether they have vaccines or not. So my dilemma is telling you all of this in 15 to 20 minutes, but there's a lot that's done in the well visit, and we do a gross analysis of well-being, and sometimes we have to tease out and do look at smaller aspects as well. So generally, like I say, after a baby is born in the hospital, they would start seeing a pediatrician or a physician within the first month of life. And then in the first year, we see them several times. So we would see them in the first week, month 1, month 2, 4, 6, 9, and then at 12 months. And then in the second year of life, which would be from 13 months to 24 years, we see them twice. So either 15 to 18 months, 15 or 18 months, and then we see them again at 2 years. And then after that, it's just an annual well visit. So ideally, all children should be seen at least once a year after they turn 2. In the first set of visits, well, all visits, one of the first things we do is we take a history, and it should be done in every visit. So there shouldn't be visits where you just get an immunization, you come and get an immunization, and you go home. No, all children should have a history taken every time they come to an encounter for their well visits. And in that history, it varies depending on the age of the child. So in the newborn period, we are looking at nutrition. This is one of the periods where they grow the fastest. So the nutrition might be brief compared to, say, an older child, because it's either are you on formula or you on breast milk? Why aren't you on breast milk? Trying to encourage mommies to breast milk, see what resistance they might have if they're not breastfeeding. How many times a day is the baby feeding? How many wet diapers are you getting so that you know that they are getting an adequate amount of milk? And then we also find out in the newborn period, how is the formula being picked? So what formula did you pick? And how is that formula being prepared? What type of water are you using? Are you boiling the water? How are you sterilizing the bottles? All of that we need to know. And in the newborn period, like I say, newborn period and puberty are the periods of fastest growth or greatest growth. Even though children are constantly growing, they have like a spurt in the first year of life, and then they have another spurt at puberty. So we need to make sure the nutrition is adequate, so to account for all of that growth that happens. Their head is growing, they're growing in length, and they're gaining weight at the same time. So we take a nutrition history, and like I said, in infants, it would be about the milk, all of that stuff. And then it changes from infancy to toddlers. Toddlers, we need to know exactly what they're having. So what are you serving for breakfast? What are you offering for lunch? What are you serving at dinner time? How many times are they getting fruits and vegetables? How much juice are you allowed? They shouldn't be getting they shouldn't start juice until they're 2, and they shouldn't be getting more than 1 serving of 100% juice a day. How much water are they taking in? What are the types of snacks that you're purchasing? And those same questions would carry over teens and adolescents. And you would find that when children are transitioning from milk to table food, you can have breakdown in nutrition. And then you would find that in the teens, you also have periods where you have a breakdown in what they're eating, because they might just be concerned about what's happening, weight, their profile, what their friends are eating. So you can have malnutrition in those areas. So we ask a lot about nutrition. And then we look at development. We ask questions about development and their developmental milestones. So for each age that we see the children, we expect them to be able to do different things. So I don't expect a 2-monther to be able to stand up. They can't talk. But I do expect them to be able to lift their head up if they're laying on their tummy. I expect them to be able to open their hands. So we ask different questions regarding development at each visit as well. And of course, after they reach a certain age, like primary school, we stop asking specific questions about development, and we ask more educational based questions. So what school is the child going to? And then we ask, what things can they do? So are they writing their name? Are they reading sight words? Versus what's your GPA? What's your favorite subject in school? What's your worst subject? What are the teachers commenting on the report cards? And sometimes in some instances, we have to ask for parents to bring the report cards in, because believe it or not, the onus of children who are having learning disorders or problems reading actually lies on the pediatrician. So especially in our government system, where children are promoted socially, so you could have a really low GPA, as in less than 1, and go straight up the system and not be stopped. And nobody said, well, does this kid actually have a problem? Can they see? Can they hear? Can they not only see what's right in front of them, but are they seeing the chalkboard? Are they understanding what the teacher is saying like everybody else? Are they able to read? So we actually have to evaluate to see if there are any learning disorders. And then we would refer to psychoeducational evaluation in the Ministry of Education if we found any deficits that's needed. So even if a guidance counselor saw it, they would refer to the healthcare system, and we have to write a reference to the Ministry of Education for an evaluation to be done. And luckily, we have the facilities in the government system for these evaluations to be done, but of course, it takes a long time to get in the system. So we look at nutrition, we look at development, we look at education, we look at sleep hygiene. So in the newborn period, that would consist of where is the baby sleeping? Are they sleeping on their back or on their tummy or on their side? How many hours of sleep are they getting? So there's a different allotment of time depending on your age, how much time we expect a baby to sleep versus a toddler versus a child versus an adolescent. For adolescents, we would ask, how long are you using a device before you go to sleep, or what time frame do you cut off before you go to sleep? Ideally, they should be cutting off 2 hours before they get to sleep so that their brain is able to slow down and they can sleep properly. For toddlers and older children, we ask, are you having nightmares? Are they having night terrors? Are they sleeping comfortably? So how many people are sleeping in the room where the child is sleeping? How many people are sleeping in the bed where the child is sleeping? All of these things can affect how they sleep and the quality of sleep, which means it affects how they learn. And it can affect their daytime. If you're not sleeping properly or getting adequate sleep, you can't learn properly, you're groggy. It affects your whole day, the following day or week or however long it is that they're not sleeping properly. We also ask about discipline. So what types of discipline do you believe in your home? What kinds of discipline do you normally resort to? Are you hitting the child, which we discourage, and definitely hitting to mark is discouraged. Are you using timeouts? We talk about timeouts. We introduce timeouts or removal of things that the child desires, depending on the age. And then make sure you praise good behavior. So sometimes we have homes where people are heavy on discipline, but they're not praising the good behavior. And praising doesn't necessarily mean giving the child something, but just letting them know when they do something good, so that you reinforce good behavior. And that's important. And it's a part of the every well visit as well. And then we talk about the social status of the child. So it might not change every time that they come, but we still have to check on it. Especially in the period in this last year, we had people who lost jobs and they lost their insurance. So you might have had parents coming in. We had parents coming in maybe in the last 30 days of their insurance saying they just want a well visit done because their insurance is going to run up. And then in some instances, people lost transportation. There wasn't a bus service for a long time. So people weren't able to come to the clinics if they were using government clinic for services. We had to check on food insecurity. So social status is a wide topic in the visit, but we just kind of ask general questions depending on how often you've seen the child. Sometimes you could review in the chart where the family is at socially and usually ask if there were any changes between visits. So did anybody leave the home? Did anybody enter the home that's now staying, extra people staying in your house? Sometimes people had to have moved in the last year. Some people condensed and they moved back home with their grandparents, so a nuclear home. You have to tell parents that they have to look out for different things when you have more people staying in the home, because it might not be as safe as your house was when it was just the parents in the house with the children. If you have cousins and aunties and uncles, sometimes kids are preyed on by older members of their family. And oftentimes when we see child abuse in this country, it's related to somebody that is related to the child. So social concerns is a big topic, and it's a part of every visit as well. So then after we would take a history, that's generally what we ask. So nutrition, development, education, sleep, discipline. Then we would look at a physical exam. So usually we examine from head to toe, everything. And then it includes screening for their eyes, checking their hearing, talking to the patient. So initially we talk to the parents, maybe up until about age 3, 4. And then we also include the child as we go along in terms of talking to the history, because you don't necessarily have to ask specific questions to children as they grow, but the way they answer you, the way they respond tells you that their development is normal. And sometimes if they are shy or their body posture tells you a lot about the child too. So as they grow, the interview switches from talking to the parents to starting to talk to the child. By the time they're like 11 years old and they're starting puberty, 9 to 11, we would start to interview the parent and the child for maybe about 5 minutes, 10 minutes. And then we would ask the parent to excuse themselves for the remainder of the discussion, not the exam. We bring the parent back in for the exam. But at that point, we want to talk to the child themselves. And we have an additional set of questions that we would ask regarding the home environment. Do they feel safe? What's happening? How are they participating? We go over education, if they're having any bullying problems in school. What are the highlights of school? What do they don't like? Friends, what activities they're in, extracurricular activities. We talk about diet again, how they see their body especially when they're going through the early pubertal stages of when they're having all kinds of changes happening. They might even have psychological changes that they might not recognize unless you point it out, that those are all because they're going through puberty and their hormones are changing. So we talk about that when the parent is not in the room. We talk about depression. We also screen for depression in the adolescent period. We talk about drugs, alcohol, leaning, smoking, vaping, all of the different types of drugs or narcotics that kids are into at this age. Not just if they're doing it, do they have friends that are doing it in school? Are people in their class doing it? Not that you're going to tell on their friends, but if you are aware of what's going on in their school, you know what they're exposed to. So some schools or some children would not know any of those words. And some children, you'd be like, do you use drugs? No. Do you use marijuana? Do you know what leaning is? I heard this word leaning. And you could kind of get like some of because of course I know about what leaning is. And some people are like, not sure. So the exposure is different depending on what school the child goes to versus their home environment as well. And it's not to say that the more affluent children are the ones that are not aware. Sometimes the more affluent children are aware of all of the different types of narcotics, and they see it every day in their school because sometimes they have more money to get these types of things as opposed to the kids who people might more likely want to pinpoint these activities on. So it's always surprising to see who's doing what. And I think in the last few weeks, we've seen a lot of teenagers, the early adolescents, 11, 12, 13-year-olds using like marijuana brownies and stuff like that, sharing them at school or sharing them wherever they are in between school and home. So we've had a couple pockets of kids come in who were intoxicated. And I mean, they had to have gotten it from an adult. So it happens, and it happens pretty often. And so it's not something that we don't hear. So we do all of those screening. We screen about sexuality. Do you like girls? Do you like boys? And you have to try to be very neutral. We can't put any of our thoughts or our feelings in the conversation because then they would close up. And sometimes some of these children don't have anywhere safe to talk or an adult that's safe to talk to. And you still have to advise them regardless of whether you believe in what they are doing or whether you agree with their choices. Sometimes very early on, they know about their sexual preference, and some children are totally unaware. So that's another thing that we talk about when the parent is not in the room. And we talk about suicide and homicidal ideations as well. So are they having thoughts about those things? Have they ever tried anything, even cutting and all of those things? That's all packed up in adolescent visit, which is from 9 to 11, straight up until they're 18 years old. So that's what a regular well visit looks like, short term. And then we address if they have any acute problems. So they might have a cough or runny nose. They might have abdominal pain. Sometimes the children who are very athletic have musculoskeletal problems, joint pains, leg pains, arm pains. So we would have to address those too. So any problem, are you having any problems today? That's another part of the well visit. And then when you look at the long term, so we're seeing these children repeatedly over a very long period, because that's 18 to 21 years if they stick around. We are looking at their growth over time. So not just for that particular visit. Every child has a long growth chart. At each visit, we plot their height, their weight, the BMI. The smaller children, we look at their head growth, and we're looking to see that they're plotting consistently along their growth curves. Sometimes they fall off, and oftentimes they go up in our setting. So whether they are underweight, overweight, obese, sometimes they have different problems that show up just by plotting them on the growth chart. So they might not be getting taller, but they're getting wider. And that could indicate that they might have a problem with their hormones or the endocrine system. Just from looking at the growth chart, you can tell that. So it's important every visit, the child should be plotted on a growth chart. And it's ideal that they're going to the same place every time, because then you get a longitudinal view of how they are growing. We also would assess their overall development long-term as well. We have periods where we assess for things like autism, starting from 18 months. And we do a screen. We ask the parents a list of questions that would at least filter out those ones who are obvious or a little bit more than just the borderline autism. Sometimes you can miss some of them because initially they don't necessarily all have symptoms that are jumping out. And sometimes if parents think, sometimes parents fudge their answers because they are not sure and they're afraid. So that's another thing that we do, autism screening. And then of course, immunizations. So immunizations never stop. People always say, oh, they got the last immunizations already. And I'm like, no, you never stop getting immunizations. It's something that goes on until even into adulthood. And then we talk about safety and safety counseling and what to expect as your child gets older. So each visit we end off by telling parents whatever age the child is. So if they're running around the house, you need to make sure your electrical sockets are covered, your water, you don't leave water sitting like in a bucket where they can turn into it. When they're learning to drive, seat belts, car seats, all of those things we would talk about in terms of safety, and then what to expect in the next period, what you expect your child to start to do next. And I think that's a global, broad perspective of what we do as a well visit. So you could see that it affects the child's well-being tremendously, because we look at every aspect of the child's life, their environment, because their environment affects them. They affect their environment, changes there in their environment, things that would cause them not to develop properly, and things that we can do to help them along the way. And that is how well visits affect well-being in a nutshell.
Thank you so much, Dr. Johnson. Your segment was very informative, and I do have a question. So for a child that's 5 years old and obese, how do you get them to eat healthier or to get back on track? Do you put them on a diet, or what do you do?
You said 5 years old? So when we go over the nutrition, usually, well, I don't want to say that you can eyeball, but you can eyeball the child when they walk in the room. And usually you would have the growth chart there as well. So even though you might look obese or underweight, I would still plot the numbers that we get, your actual height, your actual weight, your actual BMI for that day. And then I would reassess the nutrition, even though we would have spoken about it again. So, Mommy, what do you think about the fact that your child has 4 juices per day? Liquid calories are something that most people don't consider. And it's an area where even adults, but a lot of children consume a lot of calories in one day. So that usually the first thing I tackle is the juice. Just cut it out. Water or low-fat milk, almond milk, that's fine. You could probably give them a serving of juice a day. They could have flat water, sparkling water, fruit-infused water. Doesn't matter to me, but we're cutting the juice out because that usually is a lot of calories. And then depending on, there are children who eat chicken and fries every day for lunch in this country. So it's just helping them to understand that they should make better food choices. And it would start when you make your grocery list. So I don't expect you to go home today and throw everything out in the fridge, which they're not going to do anyways. But just trying to get people to understand that the food choices that they make affect how their children grow, and it's going to affect their lifestyle. I saw a 5-year-old yesterday who had early changes of diabetes, and he was obese. His mom is obese. His grandmother is obese, and portion control. So I don't like to use the word diet. I just want them to make better food choices, change the snacks that they're getting. So cheese doodles, no. We can use fruits as snack. Popcorn is a good snack. Pretzels are a little bit better. Yogurt as opposed to chips and cookies. So just giving them examples of what they can substitute. And in the public sector, sometimes I have to dispute the myths about healthy food being more expensive, because there are apples and oranges and bananas that cost much less than a chip or the cookies that you're buying. And sandwiches are less expensive than chicken and fries. So trying to go over the food changes, but it's a lot because you have to see them more than once to actually get change to start to happen.
Okay, I have a question. My question is, you talked about making sure the child well-being is more than just at one immunization time, right? But of course, most parents, they say, okay, you had immunization, but let's say your 5th birthday, you weren't sick the entire time. How does the parent know when to take the child back and get maybe a follow-up to ask all these questions and so on and so forth?
Okay, so it depends on where the well visits are. If it's in the private system, you usually get your well visit and they usually call you when it's time. In the government system, I usually tell the parents it's a good idea to get them to have a doctor visit and a dental visit around their birthday. That way they don't have to remember a specific date because even on their immunization card, there isn't a date given for the 6-year well visit or the 7-year well visit. So I just tell them when your child's birthday, it's always a good idea to try and get them to the doctor and the dentist at that time. That way I think that's easier to remember. And now all schools are requiring school medicals on a regular basis outside of just a new student. So that helps to send kids in to get seen just for their checkups.
Do you have any other questions?
I don't think so.
Okay. Oh, I have one more question. What is the best sleep position for a newborn baby?
So back to sleep, not on the tummy, not on the side.
All right. Well, thank you so much for that.
You're
And
welcome.
we're going to welcome Rotarian Leo to give a vote of thanks to our speaker.
Good afternoon, Rotarians. Good afternoon, Dr. I just want to say thank you on behalf of the Rotary Club of Nassau on your presentation.